Okay. Good evening. Welcome to the next edition of Open Evening from Herts Essex Fertility Center. We have quite a lot of people who have registered for this open evening, and I hope you're able to hear me and see me well. I'm Dr. Abha Bhatt. I'm a consultant at Herts Essex Fertility Center, and I'm here to introduce our center and explain what we have to offer for you, maybe even help you understand what your journey is likely to entail and answer some questions. While I'm doing this presentation, we have the question and answer session going parallelly, and I would encourage you all to ask any questions that you have on your mind. You can do it anonymously if you like. And at the end of this presentation, we would love to hear what you have to say to us so that we can make this more informative to you, get it to be more tuned to what your needs are. And lastly, we'll have a clinic video so that you can have a virtual visit of the clinic. In case you're thinking of popping in, we would love to arrange that for you as well. Tonight, I'm joined by Jackie McAdams, one of our senior fertility nurse, and Mana Marks, who's our marketing manager. And together they'll be answering your questions. Please look for the Q&A icon and not the chat icon, and you can ask your questions using that icon. So without further ado, we'll start with a brief history of our clinic, and it was founded as the Essex Fertility Center back in 1989. So you can see we have over 35 years of experience, and during this time, we have helped over 8,000 babies to conceive. Our center is designed to and as a state-of-the-art purpose-built center, and all the procedures that are required during your fertility journey, whether it be investigations or the treatment itself, are performed under one roof. You don't have to go for any part of the treatment anywhere else. And as mentioned before, we have the entire gamut of services that are required in the fertility journey, starting from investigations all the way to fertility treatments of different types. And I'll talk about them in a little bit of detail shortly. Now, I know that there are many people in the audience today, some as young as 22, while the others may be slightly older, and you're likely to be at different points of your fertility journey. Some of you may have started it, while others are just trying to plan it. Similarly, you may be in a heterosexual relationship, or a single man or a woman, or in a same-sex relationship. Depending on what your requirements are, we have different types of fertility assessments available, and you can find more information about these on the website. In short, if you're a heterosexual couple, we would assess you in 2 visits. The first visit is a pre-assessment visit where the man would provide his semen sample for analysis, while the woman would have a blood test to check for AMH and thyroid function tests. So these are the 2 tests that are done as a part of fertility assessment. In addition, we would check their weight and height so as to be able to calculate their BMI. We would do their blood pressure check and make sure they've completed their questionnaire that would help us assess them at the next visit, which is roughly a week later. On this visit, we would do a scan for the lady, and this would be followed by a mini consultation with the consultant, who would answer any questions that you may have and explain the findings of the assessment. In a female fertility assessment, Again, there are two visits. First is a pre-assessment where we do the blood test, and second is for the scan to check your pelvis, make sure your uterus is normal, check your ovaries, and correlate the findings on the scan with the blood tests that have been done previously. This would be followed again by a mini consultation, and we can help you plan your fertility journey from then on. If you're a single man or in a same-sex male relationship and you want to know your fertility, we can help you do that. You come in for a pre-assessment, at which time you give a semen sample. This is tested, and this is followed by a call by the embryologist who would discuss the results. In case you want to take this forward, we would encourage you to book a consultation, and we can help guide you through the rest of the journey. Some women may have had a scan before and may be aware of pelvic pathologies such as fibroids, and you may want to have a further scan to check whether there has been a change in your circumstances, and we can help you get that information by means of a 3D ultrasound scan. Some of you may be waiting for NHS-funded IVF treatment, one of the steps to which you need to have a HyCoSy or a tube check done, and we can organize that for you. These tests are normally done for couples who are considering fertility treatment with us directly as well. In case the scan reveals that there is a pathology which may impair the chances of pregnancy, either naturally or even with fertility treatments, and we can help optimize your chances through reproductive surgery, and this may be relevant if you have fibroids or any polyps, which are fleshy growths from the inside skin of the uterus. As a part of fertility journey, it's important to have a holistic approach. It's good to aim for a healthy body, mind, and lifestyle, and this can help you go a long way to conceive either naturally or when undergoing fertility treatment. I would encourage the viewers to go on our website, which is www.fitforfertility.com, which provides a lot of useful information in helping you in this regard. As far as the treatment pathway is concerned, this starts from a platform, which is an online platform called Fertility Consents. So you will need to register there, complete some forms which give us the information about yourself. If you have had any investigations done either previously with your GP or your gynec or your urologist, we would advise you to upload all those. This would be followed by an in-person appointment, which is called pre-assessment, much like the pre-assessment of a fertility assessment, where a nurse would do your pulse and blood pressure check, also check your BMI, and we do the relevant blood tests and semen analysis as well. Any fertility treatment which requires sedation, we have a cutoff of BMI 34 for those couples, and this is especially true of couples or women who are undergoing IVF treatment. The reason for a cutoff of 34 is we are a standalone unit, and we need to follow this for your safety. Once you've had the pre-assessment, we would then book you for a consultation, which could be roughly a week later. which is an hour-long online consultation. And for this is done on Microsoft Teams, and we would send you an invite, and all your details will be discussed with you. Any questions that you may have will be answered, and we would help plan the fertility treatment from this point onwards. As a part of the package, you are offered access to our app, which is Salve app, which is very useful in you keeping on top of your appointments, remembering to take all the medications that have been advised, and also find information in case you're suffering any side effects and you're not sure whether it's something to do with your treatment or something unrelated. This also provides you with the option of messaging us securely and getting answers to your questions in the comfort of your home or office, wherever you may be. Before you start the fertility treatment, you will need to have a screening blood test, which includes HIV, hepatitis B, hepatitis C, chlamydia, and gonorrhea. For the female partner, we need to check the hemoglobin level, hemoglobin type, and rubella as well. As a part of HFEA regulations, these investigations have to be within 3 months of the egg collection procedure. These can be carried out either at our center, or you can do it at a UCAS accredited lab, and we would be happy to accept those as well. Now, the simplest of fertility treatments is what is called as intrauterine insemination. And this is a procedure where the healthiest sperms which are available are introduced directly into the womb. This may be helpful in couples with psychosexual problems such as vaginismus, erectile dysfunction, or severe premature ejaculation. Either single women or same-sex women who are trying to use donor sperm can also use intrauterine insemination as a part of fertility treatment. IVF is a little more complex procedure and starts with a scan on 2nd or 3rd day of your cycle. And on this scan, we check your ovaries and record how many follicles are present in the ovaries. These are follicles which have become activated in the ovaries and are at a stage where they will respond to hormones. And we give you hormones to help grow these follicles. You take these injections every day. And these injections are what are present in your body naturally anyway. It's just that by giving you daily injections, we are just sustaining the level so that we can increase the number of eggs that we can get from one cycle of treatment. You can expect side effects such as headaches, mood swings, breast tenderness, and bloating with these drugs. And halfway into the cycle, 4 to 6 days later, when we do your next scan, we would expect your biggest follicles to be 11 to 12 millimeters, sometimes a little bigger as well. And at this stage, you would start taking a second injection, which is typically in the morning. And this is designed to make sure that your ovaries do not release eggs. So a premature ovulation doesn't happen. Each scan is followed by a consultation with a nurse who would reiterate what information has been given to you by the person who's done the scan. Sometimes you need some time to process the information, and you may have some follow-on questions. You may have questions about the drugs you're taking or side effects you're experiencing, and this gives you ample opportunity to get answers to your questions and be sure of what you need to do and feel well supported. And You roughly have about 3 to 4 scans in a matter of 9 to 12 days, during which time we would expect the biggest follicles to reach um, between 14 and 20 millimeters. And because of the estrogen hormone, which is released by these follicles, the inside skin of the uterus becomes thicker in preparation for a pregnancy that is anticipated shortly. The final scan, at which the biggest follicle is likely to be around 20-22 millimeters, will decide when your egg collection is going to be. Before you have the egg collection, you have one final injection, which is called as the trigger injection. It's typically pregnancy hormone. And we give you written as well as verbal instructions because this is the most critical part of the treatment pathway. And 36 hours later, you come in for egg collection. On that day, you're asked to come about half an hour before the scheduled time. We admit you to the recovery bay, do your baseline observations. The male partner gives the semen sample, and the female partner is taken into the theater. We do egg collection under sedation. It's not a full general anesthetic, but sedation is provided to make sure that you remain comfortable during the procedure, which takes roughly 30 to 40 minutes. And once you've had this procedure, you will spend maybe an hour or so in the recovery bay to recover from the sedation. And once you're ready, we would discharge you. As to what happens in the lab depends on what you're looking at. There may be women who are looking to freeze their eggs. This may be because you haven't found your partner yet and you want to preserve your fertility for later. It may be that you've been diagnosed to have cancer and require treatment that is going to affect your egg reserve. And it may also be that you have a family history of early menopause and therefore want to take care of your fertility preservation by choosing to do egg freezing. Generally speaking, the younger you are, the better the egg quality, and therefore more effective egg freezing is. In case you're looking to conceive with this treatment, there are three ways in which we create embryos. The first, which is the most basic, is IVF, which in very simple terms means we are going to mix the eggs and sperm and allow nature to decide which sperm is going to fertilize each of the eggs. In order for IVF to be the appropriate or the right option for you, we have very strict criteria, which includes count of at least 20 million, motility of at least 50%, and percentage of sperms with a normal structure to be at least 15%. You should have had no history of IVF before, or at least no history of ICSI before. In case these criteria are not met, we would recommend the option of ICSI, where we would inject a sperm into each of the eggs that we have. This may be also offered in men who do not have sperms in the ejaculate and require surgical means to retrieve eggs either from the epididymis or the testicles. Men who have anti-sperm antibodies and therefore test positive on the MAR test may also be offered ICSI. And similarly, couples who've had IVF before and have had either low or no fertilization would be recommended ICSI in the next cycle. So this is a video of ICSI where you can see that this is called a micropipette, which is used to pick up sperms, which are selected based on their motility and structure. So the embryologist at this point is trying to select a sperm which is appropriate. And the first step is to immobilize the sperm, which is by flicking the tail. This is very important first step before the sperm is taken into the pipette, which is like a little needle. And now here you see the egg, and you'll see that the sperm is brought right to the tip of the needle there. And then this needle will be inserted into the egg. And the sperm is injected. Before that, we take in a little bit of the cell fluid so as to enable fertilization of the egg with the sperm. So for each egg that is retrieved on the day of egg collection, we will do this injection of sperm, and the eggs are then kept in the incubator and examined the following day. As a part of the semen analysis, we also do HbA testing, which looks for the maturity of sperms. Once the sperms mature, they develop the ability to adhere or bind to the chemical called as hyaluronan, which is present on the shell of the egg. Sometimes we find men have a low maturity score on HbA testing, and these men would be advised PIXI, which incorporates an additional step of selection of sperms. So these sperms are selected on the basis of whether or not they can bind to hyaluronan, and then they are selected for injection into the sperm. When we look at the eggs the following day, this is what we expect to see. You'll see there are two pictures. On the left is a cell which has two circles, and these represent the genetic material coming from the egg and the sperm. So we need to see two of them in order to classify it as a normally fertilized egg. If we see more than two, that is an abnormal fertilized egg, and we cannot use those for transfers. Those will be discarded as they will be genetically abnormal. Once the embryo has formed, the cells within the embryo starts dividing, and this is called as the cleavage stage of the embryo. Depending on how many embryos you have, will the decision be taken as to when you have the transfer. If you only have one or two embryos, as many as you want to transfer, no further selection is required, and so you would have a transfer of those embryos within a couple days of the fertilization check. If, on the other hand, you have more than the number of embryos that you want to transfer, or you're looking at checking the embryos before we transfer, or you want to know the competence of the embryos, then they will be cultured for a bit longer. So on fourth day after egg collection, it becomes a structure which is called as morula, which is a very dynamic stage, and therefore embryos are hardly ever transferred on the fourth day. It's very difficult to classify or grade the embryos. And many embryos which are not competent would get stuck on day 4. The next stage is that of blastocyst, which consists of two groups of cells. One is a tight bunch of cells, and this will form the baby eventually, and the rest of the cells are aligned in single layer on the inside of the shell, and this is called as trophectoderm, which forms the placenta eventually. At this stage, the embryo will hatch out of the shell. You can see a little bit of the part of embryo coming out of the shell. So it's getting ready to come out of the shell, and to implant into the uterus. So at this stage, which takes about 5 days after the egg collection, we would pick the best embryo, or 2 embryos and transfer those. Generally speaking, if you have a good quality embryo, we would encourage you to have a single embryo transfer. All the surplus embryos can be frozen. If, on the other hand, the quality is poor or your age is more than 40, you can consider having a double embryo transfer, but you still have to embrace the risk of twin pregnancy. We provide the option of embryo glue, which is a special transfer medium that mimics the conditions that are present in the uterus in order to help embryos implant after the transfer. When we do the embryo transfer, you will be provided with a picture of the embryo on an A4 sheet of paper. We will do the embryo transfer under ultrasound guidance, and we do it every day of the week, depending on when it's the right time for you and for the embryo, to maximize your chances rather than playing it as per our convenience. We offer the option of PGT, which is an acronym for pre-implantation genetic testing. And this is an option for many couples, and they can be of different types. So PGTA is the one which is on offer for all couples who are having IVF treatment. And what this means is that the part of embryo which forms the placenta, we can take 5 to 10 of those cells and freeze those embryos. The cells which are taken from the embryo can be sent for testing for the number of chromosomes within. And this can help you select embryos better for a better chance of pregnancy or a shorter time to pregnancy. The reason being, there is no correlation between how the embryos look and whether they're genetically normal. And therefore, doing PGTA can shorten your time to pregnancy, especially if you have a high number of chromosomes. It does not change the quality of your embryos. It simply helps you to select better. There may be some genetic conditions which run in your family and that you are keen to avoid in your children or in your future generation, and we can help select embryos that do not have the gene through the testing which is called as PGT-M. Many couples may have, many patients may have structural rearrangements of the chromosome, wherein one part of a chromosome may be stuck to a different chromosome, and they themselves are not affected because they have the entire genetic information which is required for a normal living. However, when they're trying to have a baby, the segregation of the chromosomes that happens can cause can lead to an embryo with imbalance. So they may have either too much of a part of a chromosome or too less of a part of chromosome, and this can lead to repetitive miscarriages. So sometimes when women have recurrent miscarriages and are found to have this, they are offered this option of PGT-SR, where we would check and select embryos which are either completely normal or have at least a balanced rearrangement, so they have the full information that is required. Any embryo that is surplus, or if you're having PGT, all embryos that are biopsied will be frozen. The technique that we use is the current established technique, which is called as vitrification, this gives a very high chance of embryo survival to the tune of 95 to 97%. We have a very successful embryo freezing program at Herts Essex. Okay, so once you've had the embryo transfer, you wait for about 12 days, which is when you do a pregnancy test. Okay, so this is 16 days after egg collection or 12 days after the embryo transfer. And if the pregnancy test is positive, we would do a scan after 3 weeks of the pregnancy test. You see two pictures at the bottom. This is a very early pregnancy, around 6-7 weeks of pregnancy. And all you see, this is the little bean, which represents the baby, and this is the yolk sac, and this big black hole, that's the gestational sac. This is a slightly older pregnancy, and you can actually see the hands and feet of the baby. This is the head of the baby. And we offer 3D scans for pregnancy up until 11 weeks and 6 days, beyond which you will be discharged and you continue the rest of your pregnancy journey at your local NHS trust. We offer egg donation and sperm donation at Herts Essex, and we have an egg bank and a sperm bank. Donor eggs may be indicated in for several reasons. Women are born with all the eggs they're ever going to have, unlike men who continue to produce sperms. But as women get older, the stock of eggs that they have in the ovary depletes, and along with it, there is a parallel decrease in quality of the eggs as well. And this leads to a lower and lower chance of pregnancy as the woman ages. And the tipping point comes after 43 and more so after 45. So after the age of 43, the chance of a woman to conceive using her own eggs is less than 5%. And this is associated with a high risk of miscarriage as well. After the age of 45, your chances of conceiving with your own eggs are really, really minuscule. We do not offer to do IVF after the age of 45. Many women may have had early menopause or undergone treatment for cancer, which has led to destruction of the eggs or menopause. You may have been told that you have poor egg quality after having had IVF before. You may be born without ovaries. Single men and same-sex male couple, egg donation in conjunction with surrogacy may be the only option to complete your family. Many men do not produce sperms. This may be either genetic or maybe as a result of treatment for cancer. Single ladies and same-sex female couples may take this option of donor sperms to complete their family. Surrogacy may be indicated for definitely for male single men and same-sex male couple. Many women may be born without uterus or may have had surgeries to remove the uterus for a variety of reasons. And for all these people, surrogacy is a very good option. Here, there are two parties. One would be the surrogate and the other is the intending parents. It's of two types, the full or host surrogacy, where you create your own embryos and it's just carried by the surrogate. The other is partial surrogacy, where the egg belongs to the surrogate. With the Law Commission, we are hoping that surrogacy, many changes will happen and make surrogacy easier in the years to come. We have contracts with several ICBs, which includes Northeast London ICB. And if you're in any of these areas, including Barking and Dagenham, Havering, Redbridge, Waltham Forest, City and Hackney, Tower Hamlets, and Newham. Mid and South Essex ICBs. So the areas include Mid Essex, Castle Point and Rochford, Basildon and Brentwood, Thurrock and Southend. And North Central London ICBs. And so if you're from the areas including Barnet, Camden, Enfield, Haringey, and Islington, you can ask to be referred to us, and we would be happy to be a part of your fertility journey. In case there is no NHS funding for your fertility treatment, you can consider the option of egg sharing or sperm sharing. There are criteria that are in place that would decide whether or not you can be a part of this program, and you can contact us for further information on this. We are very conscious of maintaining total transparency on the costs of fertility treatment. They are very clearly displayed in our clinic as well as on our website. And when you have your fertility treatment, we're going to fill a form which explicitly tells you what costs you can expect, so there are no unpleasant surprises later on. As a part of a special offer, if you register for a new consultation by next Friday, which is 18th of October, we can offer you a 50% discount and on the consultation. So instead of 250, it'll be 125. You have the option of Gaia Fertility and Access Fertility for financial options to assist for the funding for fertility treatments. I would encourage you to go on their websites for further information. They allow patients to have treatments in clinics that they have partnership with, and we are one of the partners, so you can go with either of these. They have slightly different ways in which they work. While Access Fertility covers only the cycle charges, they don't include the blood tests and the drugs, and offer multi-cycle packages which end up being cheaper than if you had more than one cycle. Gaia works in a different format, and you have to put down a certain down payment with each cycle, and so successive cycles get cheaper, and they have financial options for paying back for the treatment as well. At Herts in Essex, we are very, very focused on holistically managing patients. We are high on emotional support. You will never find support lacking. As a part of the package, every couple who have fertility treatment are offered 3 sessions of supportive counseling by our very experienced fertility counselors. Through our social media channels, we spread positive vibes, and through our Salve app as well, you will never find emotional support as well as information, which helps to a great deal throughout the course of your treatment. As mentioned earlier, women who have a BMI higher than 34 will be advised to achieve the optimal BMI, and an optimal BMI would improve your chances of pregnancy. It would also reduce your risk of miscarriage. So it's not simply for safety purposes, but for your fertility chances as well. We would encourage you to have a more healthy lifestyle, and that includes dietary advice. Alex Ballard, who's a UK registered dietitian, is associated with us, and she provides dietary advice to couples. She is very, very focused and very good at her work. She's very passionate about the science behind nutrition. You'll find a lot of her blogs on the Fit for Fertility website as well. So in short, why us? Because we have over 35 years of experience. We are open 7 days a week for embryo transfer. We have an electronic witnessing system that prevents human error and prevents mismatch or wrong transfer of the embryo into the wrong person, which is such a um, uh, big deal in this situation. We have helped over many couples and have been responsible for the creation of over 8,000 babies. We would support you throughout your treatment, and this includes emotional support as well as support with information and answering your questions. And last but not the least, free parking is always a bonus. We would love to hear what feedback you have for us. This would help us make this more focused on your needs and help you in the information that you need to start or continue your fertility journey. We would be sharing the SurveyMonkey link with you, and please let us know how we did today and how we can make it better for you. Follow us on our social media platforms on Facebook, Twitter, Insta, and LinkedIn, as well as YouTube. To book an appointment, you can call us between 8 and 5, and you can also email us on inquiries@hertsandessexfertility.com. We do not have much of a waiting list, and you should be able to get a new consultation within 1 to 2 weeks. And this 1 to 2 weeks is so that you can complete the forms, have the pre-assessment, and then see one of us within this time. I'm going to share with you a virtual tour of our clinic. And as mentioned previously, do please feel free to let us know if you're interested in autumn pop-in sessions to book your slot for a show round. I hope you've been asking questions all this time, and we will continue to answer these questions till all of them are answered. So please ask your questions. I'm going to share the virtual tour now. I'm sorry, there is no voice. That's because of the Teams link. However, we will share this link with you so you can see this clip in your own mobile with the sound. Thank you very much indeed. We hope to see you shortly at our center and show you around the clinic in person. Thank you. Have a great day.